Well, hello everyone. Welcome to today's webinar, which is entitled Pushing Past Platitudes from Co-Design to Holding Leaders to Account for Achieving Real System Transformation Felt by Everyday People in Everyday Life. And we're back with the fourth webinar in our series called Putting Evidence at the Center of Everyday Life, a global webinar series for citizen leaders and citizens serving non-governmental organizations. So you might need to note that we're recording this webinar, and the recording and the slides will be available next week, and you can find them where you registered. So my name is Richard Morley, and I'm the Cochrane Consumer Engagement Officer, and I also support the Cochrane Consumer Network. And I'm very pleased to co-host today's webinar with my colleague and friend, Maureen Smith, the co-lead for the Global Evidence Commission's Citizen Leadership Group. We've an impressive lineup of speakers joining us today, and here they are listed in their order of appearance with their organizational affiliations. So thank you to Daniel, Danilo, Patrick, Bulelwa, and Bernice for being here today to share your insights. We're looking forward to hearing from you shortly. We also have the Global Evidence Commission's Jen Thornhill, Verma, and Steve Lott producing today's webinar. So following our opening remarks, each presenter will speak for 5 minutes, and we're reserving a lot of time at the end of the presentations for your questions. So we'd really encourage you to pose your questions in the chat box, and you can do that at any time throughout today's webinar as your questions occur to you. And our colleagues from the Global Evidence Commission are on hand to answer your questions and share resources in the chat. So you'll see that happening as the webinar moves along. So this webinar series is co-hosted by Cochrane, the Global Evidence Commission, and the World Health Organization's Evidence-informed Policy Network. And on screen, there's a recap of the sessions in this series. We have one more upcoming in 2024. And when Bernice speaks, she'll premise the direction of that webinar. And that's bringing a focus in these discussions to indigenous knowledge and ways of knowing. So it's my pleasure at this point to hand over to Maureen. Maureen.
Thank you, Richard. Welcome, everyone. Nice to see some of our regular webinar attendees, and a really warm welcome to anyone who's joining us for the first time. So we often refer to the Global Evidence Commission's landmark report. We've just launched our second annual update at the end of January, which once again confirms our commitment to priority number 3, putting evidence at the center of everyday life. This is a key implementation goal alongside strengthening evidence support system domestically and globally. This year's report was focused on ways momentum is building across our implementation priorities. For the putting evidence at the center of everyday life priority, we see 4 signs of momentum. First, partners are coming together, like we are today, to learn from one another. The partners who host this webinar series are an example of that, and our work is focused on showcasing effective structures and processes that support citizens to have a voice at decision-making tables so that they can better hold leaders to account for achieving system transformations. And as Richard noted, for our last webinar in this series, we'll focus on Indigenous rights and ways of knowing, building on the section of our 2022 report and working with Bernice, who is a panelist today. We see greater acknowledgement that citizens are inundated with information and misinformation, and that this is happening alongside sophisticated efforts to intentionally mislead the public, disinformation, and more commitment to finding effective ways to counter mis and disinformation. Thirdly, we also see more appreciation for the strong headwinds we face in putting evidence at the center of everyday life, such as misinformation, and for the need to lock arms to make progress against these headwinds. And finally, we see greater recognition that no single organization can lead this work, and that we need to use a collective impact orientation to achieve equitable impacts on the ground. For our part, leadership is necessarily from behind, giving autonomy to the citizen-serving organizations and citizen leaders doing the work, while providing effective guidance and support throughout the process. We remain convinced that citizen-engaged evidence production and support is a critical ingredient for putting evidence at the center of everyday life, and we will continue to advocate for this in everything we do. Every day, citizens make many decisions where evidence could be helpful. Our work in this series and otherwise is premised on showcasing effective ways we can put evidence at the center of everyday life. These are our core themes, which this year we've brought in to recognize the role citizens play in big system transformations and the cross-cutting values of building trust and focusing on equity, diversion, and inclusion. I'll now turn it over to our first speaker in Brazil, Danilo Castro, currently the journalist at Instituto Veritas, was General Coordinator of Communication and Digital Participation for the Brazilian federal government. He worked on the Brazil Participativo platform, which collects online proposals from citizens in the country in an experience of techno-civic innovation. Over to you, Danilo.
Thanks, Maureen. Hi, everyone. I'm Danilo. I'm the communications coordinator at Veredas Institute, a Brazilian NGO that works with evidence for public policies and builds connections and bridges between other organizations and governments. Last year, I was the general coordinator in the Presidency of Brazil, working with social participation of citizens in projects and public policies. Therefore, we created a big digital participation platform called Brasil Participativo for the population to share their ideas, suggestions, and dreams for the multi-year planning. Next slide, please. Brazil had a well-established tradition of participation for 30 years, but so far mainly counselors, experts, and participants of in-person conference had their voice heard. With Brasil Participativo, we opened the door of the social participation to all the citizens sharing their dreams and preference regarding policies and guidelines from the government. The experience broke a record for digital participation in the world because we aligned the strategy with social media influencers to boost dissemination. This was the first time that we had a massive everyday citizen participation. Next slide, please. This is a timeline of digital participation in the federal government. In Brazil, it only began in 2009 with a public security virtual conference with few participants. Last year, we had 1.4 million users on Brasil Participativo. It's a big case of success. Next slide. We had 4 million access in 2 months. This fact shows that Brazilian people want to contribute to the government and public policies. Next. The users could vote in other proposals and also create campaigns to endorse them. For example, 9th most voted proposal was National Dog and Cat Population Control Policy with 39,000 votes. This is an example of a new topic for the Minister of Health to think about because it is important to citizens here and the government didn't know. Next slide. Same data on usability and accessibility. 81% of individuals over 10 years old are internet users in Brazil. 62% of Brazilian internet users access internet exclusively on mobile phones. To enhance equity in participation, we added contrast and font enhancement features for people with impaired vision, functionality that translates into Brazilian Sign Language for people with hearing disabilities, automatic text reading for people who are blind. Next slide, please. The platform is in an open software. That is, the code is open for other countries and social projects to use it for free. The proposals were evaluated by the ministers after the bill was voted by Congress people. Now, the current law with the ideas from citizens will be used to guide government policy during the next 4 years. Next slide. Well, this experience was a civic technology innovation because the government guaranteed the right to social participation, which is in the Constitution, on a large scale for the first time. Thank you. I hope that this experience inspires new projects, new projects with digital social participation around the world. You can access gov.br/Brasil Participativo. Thanks.
Thank you so much, Danilo, for that really fascinating presentation. I'm sure I'll stimulate a lot of questions. Next up, in Colombia, we have Daniel Patiño. He's dedicated his team's work to exploring citizen panels, including citizen panels with children and youth. So over to you, Daniel.
Hi, everyone. My name is Daniel Patiño. I'm a professor at the Faculty of Medicine at the University of Antioquia in Medellin, Colombia. And here at the faculty, we run the unit of evidence and deliberation for decision making. And next, please. This unit, our purpose is to support decision making of different groups of community, of citizens, of professionals, and of policymakers, putting together evidence, the best available evidence, and people's values and preference. And that's where citizens' engagements comes in our process. We do this developing different mechanisms like patient decision aids, rapid synthesis, but today I want to focus on 3 mechanisms, which are evidence brief for policies, citizens panels, and stakeholder and policy dialogues. Next, please. So this is the process that we call the evidence-informed policy process, which is a 6-step process in which evidence is combined with citizens and the views of the stakeholders to inform. Our purpose is to inform the policy processes in Colombia. Next slide. The first step in this process is to develop the terms of reference. And for this, we created a steering committee with policymakers or with the groups that want to inform their policies with this process. And in these terms of reference, we define what are the policy problem, what's the policy problem, the policy options that they want to address, and the implementation considerations. So just to give you 3 examples, recently we worked with the Ministry of Health to develop an evidence brief in terms of medical cannabis, and they were interested in defining what was the THC control limit that medical cannabis should have in order to be regulated. We are also working in antimicrobial resistance in different sectors specifically to inform a policy decision at the Ministry of Health. And in the past, we worked with youth for the city of Medellin. This was not a national policy, it was a local policy to develop strategies to promote youth participation in accountability policy processes. Next. After we define the terms of reference with policymakers, we do like a kind of systematic review to develop the evidence brief for policy. In this piece, we develop a systematic search, screening, data extraction, risk of bias, and then we write this evidence brief that has the best available evidence around the problem, the options, and the implementation considerations. Next. Then what we do with the evidence brief is that we try to translate that evidence brief into a more plain language type of document that we call this a citizen's brief. And to do that, we do it in-house. We try to use infographics and other type of material that help us make more understandable the evidence brief, or what the evidence is saying around the problem, the options, and the implementation considerations. And recently, we're trying to engage citizens to help us write that citizens brief. So we give them the evidence brief, and they try to tell us what they understand about the evidence, and then we write the citizens brief, and then they review it again. And the purpose of this citizens brief is to inform the citizens panel. So next, please. So after we develop the citizens brief, we conduct a citizens panel where our purpose is to bring together citizens to discuss the evidence and to understand what are the values and preferences of other citizens around the problem, the options, and the implementation considerations. So what you see here, the first picture, it's a picture of the citizen panel that we have with youth around how the strategies to involve youth and adolescents in policy accountability process in the city of Medellin. The ideal participation is 14 or 16, but this one was a very popular one, so you see a lot of youth participating in. And the second picture that you see is the citizens panel that we have recently around antimicrobial resistance in a rural area, because the Ministry of Health was interested in understanding what were the views and preference of citizens in rural area that use antibiotics in agriculture or in other sectors different than health. And after we conducted this citizens panel, the next stage is to bring their views and preference in the evidence brief, and then to conduct a stakeholder dialogue. So next, please. So the key challenges that we find around this issue is, the first one is to institutionalize the efforts within governments to incorporate citizens' values in a transparent and systematically and in a routine manner. The second one is to assess the citizens brief and the citizens panel. And the third one is to assess the impact of this mechanism in the whole policy process. So thank you very much. This is what I wanted to share.
Thank you so much, Danielle. Really lovely to see that how you're engaging with the youth in Colombia. So I'm getting my questions ready for that later. So now in Cameroon, eBase Africa's Patrick Oquen, has developed an evidence storytelling methodology with relevance for the evidence synthesis environment. So over to you, Patrick.
Thank you very much, Maureen. So today I'll be sharing with you our experiences with reaching hundreds of thousands of citizens with scientific data or evidence on what works in settings that are quite challenging, including high income and low income settings. My name is Patrick Oquen, and I'm team lead at eBase. Slide, please. So this slide gives us an idea of what we do as scientists and those whom we expect to use the knowledge that we generate. And by the way, these two diagrams or graphs and tables, or this graph and this table, are both coming from systematic reviews where I have co-authored with Cochrane. And I was asking myself that how do we get this to these people that we see in the marketplace? For example, the common man you will meet on the way, those people who are not scientists. How are they going to understand a forest plot? How are they going to understand a violin plot? How are they going to understand a grade table? And over time, working with a team of great storytellers, traditional storytellers, and scientists in Cameroon, we've been able to develop a systematic approach where we can communicate evidence from systematic reviews, primary studies, from lived experiences, from practice to community members. Slide, please. So, in order to save scientists talking to themselves, we were asking ourselves, how can we get this data to the public? And we developed an approach called Evidence to Read, which is actually developed from an African local language, which is saying that let's talk evidence. And we have used this extensively, not just in global health, but also in education, in climate change, in finance. And it has 6 steps. And after identifying a topic, for example, we want to talk about climate change, or we want to talk about COVID-19, or we want to talk about malaria, we want to talk about intermittent fasting, we have to go through a series of steps. And this series of steps is what we have coined together with the traditional storytellers as the coming of the 2 rivers. I'm going to describe as we move on the slides what these 2 rivers are and why these 2 rivers should come together. The first step is the community diagnosis. Then we have the river of science. Then we have the evidence statement. Then we have the co-creation of stories. Then we have the river of stories. Then we assess the change that we have been able to create. Slide, please. So the first thing that we usually would want to share with you is the question is, how can you explain your evidence to a 5-year-old so that she understands? Let's assume that a 5-year-old child has to take a vaccine, and the child doesn't understand why you have to give them a vaccine. How can you communicate this data from the research that shows that she's more likely to see her 20th birthday and more if she takes a vaccine? Slide, please. So we have been able to define what evidence to read day is. And the definition that we have come to on evidence to read day is a systematic, interactive approach of communication of data and evaluation of change based on indigenous African principles of storytelling. Evidence to read is a local pidgin language spoken in Africa, which means let's talk evidence. And storytelling employs use of recounting, drama, dance, poems, mimes, and songs. Slide, please. So here is a cycle of evidence to read, and these are the 2 rivers that come together to form a single river that is more accessible. So the story around this is that now there are scientists on one end trying to communicate research data so that policymakers, practitioners, and the general public is able to take up the information that they have generated and then use it in their policies, in their practice, or in their everyday life. However, this river is running downstream, and downstream, it's impossible for people to access that river because of so many complexities that we will see or that we are all probably aware of. So then comes the storytellers. The storytellers come with stories that digest the river of science. So their own river digest the river of science, they meet, and then the river bed now increases and is now accessible to everyone. Slide, please. So the first step in evidence, in communicating the evidence, is knowing your audience. In Africa, the traditional storytellers have a saying that you cannot tell a story to someone whom you do not know, or you cannot tell a story to an audience that you do not know. So usually in storytelling, the first step is always to know your audience. And in order to know your audience, you need to, what we have done is that we've worked with traditional storytellers to be able to align their understanding of knowing your audience to the trans-theoretical model of change. And this is an approach that we are actively studying to understand how storytelling can come in at different levels. We have so many very interesting uh, um, uh, uh, experiences on how you could go into a community to tell them a story and you misdiagnosed their level of change and your story is completely off topic, off sensation. So they don't even communicate. So being able to know that these people who do not want to take the COVID vaccine are in pre-contemplation, or in this community where number of COVID cases are still increasing, people are struggling to have access to face masks. And COVID is just an example. It's the same for malaria, it's the same for measles. So many different things. You need to know where these people are located on the trans-theoretical model of change to be able to to tell them a story that's going to connect with them. Slide, please. And in the next slide, we are going to see here is the river of science, which is the evidence, the data, the science, which most of the time is too complex for policymakers, for practitioners, for the public, and is usually not accessible to them. This river is too deep and they can't reach out. And most of the time, the river is in English. So those who speak other languages, including even those who speak Spanish or Chinese or French, are not able to access most data, including data or studies that were conducted in communities that speak languages different from English. Slide, please. So after the river of change, the river of science, what we want to do is to break down the evidence so that 5-year-old is able to understand this. So we develop short evidence statements. This is something that is simpler than even plain language summaries and could say something like, in the case of intermittent fasting, like Joseph, who is undergoing intermittent fasting, is going to lose 5 kilos before Matthew loses 1 kilo over a 6 months period, something of this nature. So something that is so simple, so explanatory that even a 5-year-old can understand. Slide, please. Then the next step is the co-creation. It is very important that in creating stories, the scientists and the storytellers work together. And they also take into consideration experiences that came previously from the community diagnosis. So the values of co-creation are very important and very well embedded in our evidence story day approach. And in particular, we consider Ubuntu principles, which is an African principle, an African philosophy of collective fingers theory, which goes across most of Africa in different ways and in different terms. Now, we also want to be sure that the message in the study is the same message that is in the story. It is very easy for these to be different. And we also want to consider the audience and their behavior and the changes in theories. Slide, please. Then we want to now look at the river of stories. And the river of stories is probably the most exciting part, where we now tell the stories. In telling the stories, we ask the people to also still share their experiences after we tell the stories. And we classify stories or experiences that are coming from people into red and green stories. And we use this to develop further stories that we tell them back. And this, from our experience, tends to inoculate the community. Slide, please. And the final step is that we would now assess to see if we are improving knowledge, to see if we are changing intentions to take up new innovations or to take up new evidence-based practices, and then to also check if we are also changing behavior. So that completes the cycle of Evidence Story Day. Slide, please. The next group of slides, please just run through them. It's just an example to show you what we have done, what we bring through, what kind of data we bring across, how we bring on board behavior change techniques, shorten the evidence statement, communicate to the people. Thank you very much. And I share Kola Nuts with you.
Patrick, I want to thank you so much for that fascinating and really engaging presentation. I've long been an admirer of your work, and I'm sure that people will have some questions about this really important example of the power of storytelling. So thank you so much. Next, our next presenter from South Africa is Bulelwa Mafela, and her work on end-of-life services for the proper handling of human remains offers insights on the implementation of public health and environmental policies. So Bulelwa, over to you. Thank you.
Thank you very much, sir. The name is Bulelwa. I'm from the University of Johannesburg. I reside in Soweto. Hence, I'm doing this study because, as you would know, that in South Africa, we are plagued by high levels of unemployment, and our government is struggling to really create employment for communities. So what happens is communities start businesses and they become survivalist, which is okay. We call them SMMEs or micro businesses. But the challenge with this particular business of emerging funeral directors, you would see as said EFDs, it's because of what it can cause in terms of environment and other avenues. I will explain as we go. Let's go to the next slide. So what sparked interest for me in this study, it's there was a strike some years ago, and the idea was from the service providers, which I call EFDs, Emerging Funeral Directors. They said, we are not collecting any bodies from any mortuary. Even if someone dies at home, we are not going to collect the body if the government is not becoming lenient with us in terms of compliance. Next slide, please. So that would mean the small businesses are supposed to interact with the national health policy, which has got guidelines. We call them Regulation 363. It only speaks to the human remains from the whole framework of the national health policy, which is a bit cumbersome for survivalist and emerging businesses to be able to be compliant. When I talk about compliance here, I'm talking about someone who's got a mortuary. And if this person has got a mortuary and is non-compliant as per the guidelines of the national health policy, does it mean that they have a mortuary? So research teaches me as I go, because there is no evidence that according to the policy, they shouldn't be operating, but they operate anyway. But now the challenge again of the policy is it's with implementation, because they are survivalist. They are servicing poor communities. The government cannot service those poor communities. So somehow they get away with murder. They continue operating. Next slide, please. So now I'm from economics. I'm not from health sciences. What am I doing with human remains management and the national health policy? So in economics, I'm in a cluster of local economic development. So in local economic development, we normally focus on small businesses and emerging businesses. How can they be supported? What policy is there from the municipal point of view to support these emerging businesses? So unfortunately for me, or fortunately for me, I chose this business. So that is how now I'm combining economics and the management of human remains under the banner of national health policy. The next slide, please. So do they fall under local economic development, these emerging funeral directors? Yes, they do, because research says they contribute about 10 billion a year to our GDP. Now, the services that they provide, our government cannot provide those services, but are they able to assist them to be compliant? The government feels that it's not their business. I'm talking about the policy here. So the role of local economic development here is to make sure now that you get the government to speak to the EFDs. and to find out exactly what is it that makes them not to be compliant, because if they're not compliant, they are affecting the environment negatively. Next slide, please. So I won't go much into this. I've explained this, my relationship with the EFDs and how do I interface with the national health policy. Let's go to the next slide. I'm trying to stick to the 5 minutes. So now I looked at our policy development in South Africa, and I looked at SDGs, and I looked at this interest that I have, or this research niche, and I wanted to see as to what can I say now if a small business is running a funeral parlor where they handle human remains. What would be the impact of being non-compliant to us achieving the SDGs? So now I learned that South Africa, with our National Development Plan, we are plugged into the SDGs, but there are certain avenues that we cannot manage as a country, the small businesses that are running funeral parlors. So does it mean that we are getting closer, we are achieving the goals as per the SDGs, or we are moving further away? My research so far since 2020, it says we're moving further away because we cannot implement the national policy guidelines as to how to handle these human remains. But the challenge is there is no evidence to support what I'm saying. So I had to start from the beginning and collect primary data. I think I've published about 3 papers so far. So I rely on all these various pieces of legislations and municipal bylaws to be able to write what I'm trying to write at a given time. Let's go to the next slide, please. So here I've explained how I've conceptualized the research. There was a strike, and when there was a strike, I wanted to speak to the people that were striking, but it was difficult. They were very angry. They sent me to the environmental health practitioners, who said to me, we are struggling with the very same people that are striking because we are refusing to give them certificate of competence. So it means they're not supposed to be running funeral parlors. But the question is, now who's going to bury the very same community that is in poverty? There is no answer to that question. Let's move to the next slide, please. So this is my last slide. So I've just taken from some of the papers that I've written, the questions that I've asked the environmentalists, and the same questions that I've asked to the emerging funeral directors. I won't read everything out, but the main thing is about issues of compliance. The emerging funeral directors feel that the regulation as per the national health policy, it's so stringent that for a small business, they cannot be compliant. The EHP says, if you cannot be compliant, you cannot be running a business. The government is saying, I cannot bury for the communities because I don't have the resources, I don't have the capacity. So we are sitting at that right now. I tried to speak to the government to find out as to how can they assist those emerging funeral directors where the non-compliance is not that material to the physical environment. So we are still in talks with that. With one of the provinces, I succeeded because one of the departments, which is the local economic development department, said, finally, we understand the struggle of the EHPs. We need to work with them to assist the emerging funeral directors so that we can keep our environment neat and clean. So that is my story for the day. I will welcome the questions after the presentations. Thank you.
Thank you so much, Bulelwa. Very interesting work, obviously very challenging, and looking forward hopefully to talk to you expanding on your inclusive and participatory planning to get the community buy-in. So finally, and last but not least, is Canada's Bernice Downey in Canada. Her work supports Indigenous research policy initiatives as a member of the Canadian Institute of Health Research, Institute of Aboriginal Peoples' Health, Institute Advisory Board, and including her work as one of the Indigenous leads for the WHO Commission on the Social Determinants of Health, Canadian Reference Group. Notably, Bernice's presentation will also premise our 5th session on this global webinar series. Over to you, Bernice.
Thank you. Bijou. Minogijagan, bonjour, good morning. Bernice Downey, Niganakwe, Dijijnakos. Baji Ganik, Nadijnakos, Lake St. Martin, Dauphin River, Nadunjaba, Ontario, Dindau, Anishinaabe, Endau. Greetings, it's a beautiful day. My name is Bernice Downey. I have also been given the name of Niganakwe or head woman. I'm an Ojibwe Soto woman, and my family ties are with Lake St. Martin and Dauphin River First Nations in the Treaty 2 area in the province of Manitoba, Canada. I also have Celtic settler ancestral roots from County Down, Ireland. I'm a medical anthropologist, and I also have had a long nursing career. As noted in the session description, through various leadership roles in my career, I have participated and advocated for Indigenous health policy reform. Of particular note, as one of the Indigenous leads for the WHO Commission on the Social Determinants of Health Canadian Reference Group. The Commission's work, as noted in their 2008 final report, included the engagement of Indigenous peoples across the globe, and it is an example of how global networks can address health and social inequities within member states by influencing policy reform with self-determining strategies, many of which you've heard here today. This morning, I want to speak to you about another important issue that relates to our webinar focus, and in fact, what a few of our presenters have talked about, and namely, that is of the need for culturally relevant knowledge translation for Indigenous peoples and others engaged in the development of service programs and policies. From an Indigenous context, the lack of inclusion of Indigenous peoples perpetuates the experience of culturally unsafe care. Secondly, for Indigenous peoples, we need to consider the context of collective insight, experiences, and their own identified priorities and processes. This requires meaningful consultation and inclusion of Indigenous self-determining approaches. Next slide, please. So here what you see is a schematic of this concept of cultural dissonance of knowledge translation. And so we can say that mainstream research institutes have emphasized knowledge translation as the key link between academic health sciences research and improved health outcomes. However, here I identify a major systemic challenge, namely that a key barrier to a more robust and culturally relevant KSTE of Indigenous health research is a lack of understanding by non-Indigenous clinicians, researchers, civil society, and policymakers of the sociocultural historical context. And this results in the ongoing lack of culturally relevant primary care for Indigenous peoples. Multiple factors are cited, but an important one related to our dialogue today is that of epistemology, of differences in knowledge systems and a need for an improved interface between Indigenous communities, researchers, and policymakers. I consider this issue to be about a cultural dissonance in the mainstream research world regarding Indigenous research methodologies, and in particular, the KSTE process. Mainstream research on Indigenous peoples has largely been void of culturally relevant, meaningful, engaging, contextual, or decolonizing knowledge, as noted by colleagues Morton, Nino, Maya, et al. And this is a situation that has potential to perpetuate the status quo of inequitable health outcomes. In fact, in 2008, Cochrane noted that while a large amount of health research among Indigenous populations has occurred, it has not had a significant impact on overall well-being. Next slide, please. And so here you see a visual. I'm sorry, it's probably hard to read, but what you see here is a demonstration of a local knowledge translation context that arose out of storytelling. And so Indigenous knowledge is global insofar as Indigenous people share common histories and concepts. However, each community has specific methods for knowledge synthesis, translation, and exchange. Indigenous knowledge, therefore, is known as being local. And so here what you see is a translation methodology that depicts the storytelling process and looks at the individual context, the family, the community, and the nation. And so it is interrelated and also holistic. Next slide, please. So when we think about the path forward, the year 2017 was of particular significance for Indigenous peoples, marking 10 years since the adoption of the landmark United Nations Declaration on the Rights of Indigenous Peoples by the General Assembly in September 2007. The UNDRIP, as we call it in Article 19, states that notes that states shall consult and cooperate in good faith with Indigenous peoples concerned through their own representative institutions in order to obtain their free, prior, and informed consent before adopting and implementing legislative or administrative measures that may affect them. Secondly, that UNDRIP also recognizes that respect for Indigenous knowledge, cultures, and traditional practices contributes to sustainable and equitable development. In Canada, UNDRIP received royal assent on June 21st, 2021, and it declared that the laws of Canada will be made consistent with UNDRIP and affirms UNDRIP as an important source for interpreting Canadian law. It also sets out timelines for the government to create and implement an action plan to achieve the objectives of the declaration. And so what we are seeing within Canada is the application of these articles to processes undertaken by individual Indigenous peoples and their organizations. The second process I'll comment on is the Truth and Reconciliation Commission of Canada. And this is a commission that provided those directly or indirectly affected by the legacy of the Indian residential school system with an opportunity to share their stories and experiences. And in their final report of 2015, they focused on the need for data that it's imperative to have in order to make calculated and real-time informed decisions, but it needed to also be consistent with metrics that were culturally relevant for Indigenous peoples. Next slide. And so, as mentioned by the organizers, the fifth session is going to be looking at Indigenous knowledge, and that will be the major focus. And I hope to hear from a number of other Indigenous colleagues. But essentially, our colleagues are calling for and noting that for years, Indigenous elders, knowledge guardians, and scholars have championed the need for more Indigenous research that honors and respects the contextually relevant ways of knowing and doing in health research. And partnership approaches have been identified. For example, Morton Maya and colleagues asserted that if KT is intended to benefit Indigenous peoples and lead to improved health and wellness, that it's imperative that there is an awareness and funding to support our research, that we hold researchers, funders, and journals accountable to Indigenous communities, that research ethics, methodologies, and approaches, including knowledge translation, be included in research training for non-Indigenous researchers, and that research upholds and follows nation-based Indigenous ways of doing knowledge translation. And finally, that successes and lessons learned on knowledge translation and research be shared in accessible and transparent ways with Indigenous communities and academic researchers. Miigwech, thank you very much.
Miigwech, Bernice, we look forward to that fifth webinar. We now have an opportunity to take your questions. If you have questions, please feel free to add them to the chat box and direct your question to one of our speakers. Thank you so much. And thank you to our 5 inspiring panelists. Thanks,
Maureen. So it's my privilege to ask the first question on behalf of our audience today. And the first question is for Danilo. So Danilo's first language is Portuguese. So I think Laura is going to do some translation, and Danilo will respond in Portuguese. So the first question we have is, Danilo, do you know of any uptake by other regions or countries to use the open source platform that you've created? I don't know whether it's possible for me to add a second question, but of all the questions that are being asked by the community, what has been the government's response? Because what's the impact of your work? That's 2 questions. Very, very cheeky of me. But...
Okay, thanks, Richard. Bem, outros países e regiões já utilizaram essa experiência com a plataforma Decidim, que é a plataforma que hospeda o Brasil Participativo. Então, a gente se inspirou numa experiência de Barcelona, que foi realizada pela Prefeitura de Barcelona, e depois isso foi realizado aqui no estado do Amazonas, mas em proporções bem menores. O Brasil acabou se tornando uma experiência de destaque justamente porque somos um país continental com 210 milhões de habitantes e com a possibilidade de repercussão de uma política digital muito grande. Então, existe sim uma comunidade de software livre trabalhando com o Decidim para que processos participativos aconteçam tanto em projetos da sociedade civil quanto em projetos do governo. Sobre a segunda pergunta, the second answer, qualquer pessoa com CPF no Brasil pode participar fazendo propostas para o governo nos momentos em que a plataforma está com algum processo consultivo aberto. Então, outras pessoas, basta ter CPF, inclusive pessoas menores de idade, inclusive políticos, autoridades. A gente só precisa que essas propostas não firam os termos de uso da plataforma e também atendam aos princípios dos direitos humanos.
So quickly jump in. So I work with, Danilo in the Veredas Institute. So Danilo was saying for the first question, Richard, that the platform they use for Brasil Participativo is called Decidim, and both the mayor, the town hall in Barcelona, and a state of Brazil called Amazonas had previously used the same platform that is all based on open software. But what Danilo was highlighting is that Brazil was the first major experience because we are a continental country with 210,000 million, inhabitants. So it was used in a larger scale in Brazil, but this community of open software and open access was improved by the Brazilian experience as well. And right now we are trying, especially regarding the equity enhancements, to disseminate this to other countries who want to use it. For the second question, Danilo was highlighting that the platform is open for anyone, even politicians or people who are underage, to propose bills or surveys and gather insights from all around the country. And the actual use that he presented was to build the four-year national plan. So as soon as the proposals were voted there, they went to the Congress, and now they are like the guidelines for government action throughout the next 4 years. And this is major. So it's directly influencing the policy. It has a process of being approved in the Congress, but it's quite remarkable, the consultation to policy path there, very quick.
Thank you both. Obrigado. Maureen, over to you.
Yes, I'm going to go back to Danielle because I did promise him a question. And Danielle presented on the citizen panels in Colombia, and you did mention this as a key challenge, the impact. But in what ways are you assessing that impact and utilization of the citizen panels in the policy cycle? And I'm going to add on my little thing about the youth. And if you are measuring the impact, do you measure the impact that some of the youth panels had differently, or is it, are there differences in those two different processes?
Hi, Maureen. Thank you for your question. So I think it is a challenge to assess the impact. It's always a challenge to assess the impact of these mechanisms, or how these mechanisms are informing policy. But we are working on a project that is trying to assess this. So every time we have a citizens panel, or every time we finish evidence-informed policy process with policymakers, we have a series of evaluation strategies. We have, it's like a mixed method study where we ask the citizens first what they think about the evidence brief, what they think about the information, what they think about the evidence. And then we have specific interviews with them. And then with policymakers at the end, we try to assess whether this whole process of engaging citizens, of engaging evidence and citizen values and preference, how they use it in the policy process, whether it was like an enlightenment type of use where they understand the problem different because citizens were framing the problem in a different way, or whether they see the policy options that they were thinking were more acceptable in some groups than in others. So we try to, at the end of the process, we try to do interviews with policymakers to ask whether this process of putting together evidence and citizens' perceptions was useful or valuable for their policy process. So we are now in the process of finishing that. Is going, the deadline to finish the project is at the end of this year, and we are conducting different citizens panels and stakeholder dialogues, and we are assessing that process to see what policymakers think of them. But I guess there are multiple ways, Maureen, to assess the engagement of citizens in policy, and that part, I think we need a lot of evidence or research. There is a research gap to try to assess how to engage citizens and what is the impact of that.
Thank you so much, Danielle.
Thank you.
Over to me now, and for a question for Bulelwa. Bulelwa, I wonder if you could speak a little bit more about the role of citizen engagement in your end-of-life services work. So did you involve citizens in that research?
Okay, thank you for the question. So my view is, I think I follow what you're saying, but my view is the very same service providers, they are citizens, so they are driven by the need that they observe in their local spaces to become service providers. So yes, the citizens do give business to these small businesses, and mostly because they cannot afford the established businesses, of which there are very, very few and expensive. But what is their view? Their view is another big area of research, because the very same service providers, they sell packages that are sometimes unnecessary, and people get excited and forget about the real core business that they're supposed to be, service that they're supposed to be receiving from the emerging funeral directors. So it's another avenue that I would need to do research on. But as of now, there's a challenge because they pay premiums to the very same emerging undertakers, and they get to be promised a service that is way above the premium they're paying for. And exactly when there is death, they don't get what they were promised to get. So that's another issue that needs to be investigated, because you would see that there's some form of malpractice from the EFDs, but we are trying to treat them with kids' gloves, because they are providing an essential service, but they're not doing it right. And not all of them, again, I repeat.
Thank you so much.
Thank you.
Thank you. Thank you.
Hey, for Bernice, we've mentioned that we're going to continue the series to pick up on your presentation. And in the founding report of the Global Evidence Commission, we included a section on Indigenous rights and ways of knowing. Why, in your opinion, is it so critical to have this conversation as part of our series of putting evidence at the center of everyday life?
Thank you, Maureen. That's a good question, and it's a very complex question at the same time. It's best expressed perhaps through the words of a colleague, Carol Hopkins. She's the executive director of the Thunderbird Foundation, and she's a respected elder and leader. And so she talks about that when Indigenous knowledge is allowed to root in our lives, it nurtures our ancestral DNA, and it's reflected in our personhood and in our life. And that in this way, we're able to share in its fruits with the world around us. So this very space between human beings, between humans and all of creation, is nurtured by Indigenous knowledge. And we sometimes refer to it as our original instructions. And so for Indigenous peoples, being able to express ourselves through our worldview, sing our songs, speak our language, tell our stories, as we heard today, and connect to the land, which they're all part of our original instruction and are key to our health and well-being. And so when we are living out these original instructions, it creates a way of life that's connected to the Creator and the way that we were meant to experience our lives. And so, you know, we talk about evidence of health, wholeness, and wellness that's seen in these things that help to improve our general well-being through healthy reciprocal relationships, pride, functioning family structures, and a healthy community. And so, you know, I think it's really twofold. It's about creating spaces where Indigenous peoples can explore, discuss, harmonize what we know about how we live and how we need to do things. And then it's also about educating our colleagues and others around us so that we can harmonize the approach for Indigenous peoples. And so when we're talking about getting evidence to community, this becomes a foundational exercise that we need to take part in together. I hope that answers your question.
Yes, it does. Thank you, Bernice.
Thanks so much, Bernice. I'm afraid we've run out of time. I don't know where that hour went. It's passed so quickly. I want to say a couple of things before we've finished. First of all, I'm sorry that we didn't get a question to all of our contributors today, but we're going to continue to share the recording of this session and insights from our speakers on X and LinkedIn and in our newsletter. So please have a look there if you do follow people on social media. I want to say a huge thank you to all our speakers and participants for joining us today. It's been a fantastic session. I'd also like to say thank you to the organisers of it as well, who've done such a fabulous job in bringing this together. So thank you to all. Please do watch out for our next session of the series and look out too for our second annual update in 2024. And that's the end of today's webinar. Thank you so much for everyone, and thank you for joining us today. Thank you. Bye for now.